I'm Nicholas Markey here, physical therapist at Beach Barbell Physical Therapy. I'm a physical therapist by day and an online fitness coach by night. Today I wanted to go over a quick topic here, but I think one that's important, and basically how your insurance and deductible works, right? Oftentimes we shy away from kind of talking about finances as between the healthcare provider and the patient, but obviously finances are an important aspect to our lives, right? So how your insurance works, basically, you have a premium, right? You have a premium, which is your monthly fee, essentially, right? And then those can vary depending on, what level of the insurance you buy and the different insurers and blah, 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 okay? And then most insurances are going to have what's called a deductible. And how a deductible works is that generally, until you've met that deductible, you are responsible for all your medical bills. Let's say you have a deductible of $2,000. That would mean that until you've spent $2,000 or till $2,000 of claims have been sent to the insurance, you are responsible for that bill, right? So you see a medical provider, let's say they send a claim for $100 to the insurance, you're going to be responsible for that. Now, different insurances will have different contracts sometimes, depending on if they're in-network, out-of-network, blah, 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 but let's not get too complicated here. So essentially, you're the one footing the bill until that deductible is met, right? So until that, if in this case the $2,000 of medical dollar claim has been sent to the insurance, okay? Then sometimes insurances will also list what's called an out-of-pocket maximum. Out-of-pocket maximum is like the maximum amount that you will pay out of your own pocket. So sometimes there'll be like a deductible, and then there'll be an out-of-pocket maximum. So oftentimes the out-of-pocket, once you've met the deductible, a lot of insurances will have a co-insurance, which may just be a flat copay fee, like $20, $30, $40, whatever, or it might be a percentage. So let's say you have a $2,000 deductible, an out-of-pocket max of $6,000, and a co-insurance of, let's say, just keep math simple, 10%, right? So once you've met that $2,000 deductible, right, there's been $2,000 worth of medical claims sent to your insurance that have been accepted and all that, okay, and then now let's use that same $100. So the practitioner bills $100 to the insurance. In theory, the insurance will be paying now, since you met the deductible and you still haven't met the out-of-pocket max, in theory, then you would be paying 10% of that $100, so you'd be responsible for the $10, and the insurance would be responsible for 90% or $90 in this case, okay? And then up until you've met that out-of-pocket maximum, let's just say it's $6,000, then once you reach that, in theory, you shouldn't be responsible for any bill after that. So that's kind of like where if you get, seriously injured or seriously sick and you're on the hospital for days, right, you're going to meet that out-of-pocket maximum pretty quickly. It's maybe after 1 or 2 days in the hospital, you might have already met it. So that's kind of just how in general it works. Now, over the last few years, there's been changes to a lot of people's insurances, different marketplaces, yada, yada, yada. Health sharing plans have become more popular. There's a lot of different things, HSAs, FSAs. So what happens now is hopefully to help actually with healthcare costs, people start to become better consumers. Because like say that, and we've seen, several insurances like this, you have like a $5,000 deductible or a $10,000 deductible. I mean, until you've spent $10,000 worth of medical bills or claims or whatever have been sent, you're responsible for basically everything. So that means that you as the patient, the consumer, now kind of has probably to be a little bit more judicious with your financial resources because you're responsible for it. So, potentially shopping around more, asking ahead of time, like, hey, what are your fees, right? because a lot of practices aren't very upfront about this. And in physical therapy in particular, I've seen what happens oftentimes is person will schedule, they say, oh yeah, we bill your insurance, yep, we're in net, even if they're in network, right? And you still have a high deductible even if they're in network, versus out of network or whatever. So you go in, you do your evaluation, they send a bill to the insurance, you got a $5,000 deductible that hasn't been met. Nobody's really telling you that, hey, look, you've got this $5,000 deductible that you have not met anything yet, per when they checked your records. So you're going to be responsible for every single bill probably. You're just maybe going to get it on the back end and not really realize it. So then maybe you set up, 2 to 3 times a week physical therapy for 4 weeks, right? What if they're billing your insurance, $200 so each one of those sessions, right? That cost adds up, right? So I personally, I like to be upfront about it, because I think we need to help people. As a medical practitioner, the finances are an important part of this person's life. They're not nothing, right? And so it's part of them, it's part of their care, and I think it's reasonable to make your recommendations. Like, for instance, me, I'm the medical personal trainer because I know that exercise can help with their symptoms, generally back pain, neck pain, shoulder pain, whatever. I know that exercise therapy and progressive exercise therapy can help with their symptoms. And I also know that strength training and exercise is a very good intervention just for health, right? So kind of a double whammy. So I don't mind being the medical personal trainer, for physical therapy. And, ideally someone is strength training, ideally maybe 3 times a week. Now, does that mean that they're going to be with me, the physical therapist, watching over them maybe not? Kind of depends on the person, right? So maybe for some people I go, I highly recommend you do 2 to 3 days total. Maybe one of those is with me and I'm kind of teaching you the principles and whatnot, and the selections and whatnot. And so then you then go and do your own sessions, and then when you come back you can kind of report back any questions and whatnot. We can go over those and practice things as needed, and then kind of continue working, progressing and moving forward. And then another person might decide, hey, you know what, I think it's worth just coming here to see you 2 times a week, 3 times a week, because I'd rather be under your supervision, and then maybe we can taper off to twice a week, to once a week, to once every couple weeks, once a month, whatever. Kind of a lot of options in terms of that. But I think kind of putting that towards the patient, putting them in the driver's seat and kind of giving them at least letting them know up front what's, kind of what's expected and what's going on, so that then they can make a decision, as opposed to it just being like, oh yeah, twice a week, yeah, I'll come in twice a week, no biggie. And then all of a sudden, they get this big old bill coming around on the back end, and they're like, what? Maybe I could have just done once a week and got a membership at a gym and started doing, kind of started building up on my own too. So, there's all those little things to juggle and be aware of. So, like I said, I personally like to kind of let people know that, I think it's important for medical practitioners to, because most people don't really think about it, don't really understand that. And so I think it's important for us to help them understand that. And like I said, we personally at Beach Barbell Physical Therapy, we keep our fees really upfront. You can see them on our website. I bill the same thing to the insurance. Like, I don't want to play any games, because I think that we need to be a better, big part of the reason why healthcare costs are so high is that we're not really looking at these finances and if certain things are really worthwhile spending money on, because a lot of times people will go, oh yeah, let's just go do this, like let's go get an MRI, let's get it checked out, and then they bill the insurance, and then all of a sudden there's this big old bill coming in and hitting the person, and it's like, was that MRI really necessary? Like if somebody, had, non-specific knee pain and they haven't tried any conservative therapy, and they're like, oh, let's just do an MRI to check it out. Where that MRI, if that was going to actually change their course of care or recommendations, right? If it wasn't, like, in my opinion, you shouldn't get an MRI unless it's like you're going to go based on what the MRI says. I'm going to go this way, or I'm going to go this way. Like, am I going to have surgery, or like, no, so barring that, like, generally it's not warranted. And so a big part of our high healthcare costs are those unwarranted testing. And a lot of times, because people don't really realize that they're going to end up being responsible for that bill, right? If like an MRI, it's like $3 to $5 grand, they're going to bill to the insurance, and the insurance is like, that's cool, you haven't met a deductible yet, so here's your bill. And so as opposed to maybe if they're like, you should go to a physical therapist, and then maybe you shop around, maybe you find a therapist that seems to be your cup of tea, maybe you go and actually do a couple evaluations at a few different places and then kind of decide from there, right? Like, it's okay to get a second opinion. Different therapists are going to have different, mentalities and how they treat and whatnot. So why wouldn't we treat that as like those are different practitioners? Like, just because someone went to one physical therapist and it didn't go well, they didn't fail physical therapy. That's really silly type of talk I see a lot in notes. Oh, they fail physical therapy, and I'm kind of ranting now. But shopping around, asking prices over the phone, I think it's good, just like you go on Amazon or Walmart or whatever, and you're kind of comparing prices and qualities and making decisions for yourself. So same thing should be in healthcare. So I hope this was helpful. I'm going to continue the talks. I just figured I'd take a little break from back pain stuff a little bit. So anyways, we'll continue with our regular programming. And again, if you help me out, like, share, subscribe, comment, ask questions, please engage. Let's try to help everyone out here. And I'll see you next time. Peace.